pediatric flu cases are surging across the country and here in Western New York, putting a strain on doctors' offices, hospitals, and emergency departments. On top of that, you've got RSV that we've been talking about. 2 on Your Side's Kelly Dudzik brings us an update tonight from Oishei Children's Hospital here in Buffalo on how these respiratory illnesses are impacting Western New York healthcare providers and a whole lot of families.
In terms of what we're seeing a little bit less RSV and a significant increase in the flu, unfortunately.
And that is putting a strain on the emergency department at Oishei Children's Hospital, with more than 200 patients a day coming in.
We've opened up 8 additional rooms for our emergency department, actually in our lobby, which has been helpful for some of those less acute patients to sort of get them in quicker.
They have about 40 beds opened up in non-traditional areas in the hospital to handle this latest respiratory surge.
When a child or person presents to the emergency room, they're immediately seen in triage. So the nurse who sees them will look at how acute they are and how severe they are. And then they're given a number of 1 to 5, 1 being the most acute, we need to see you right now, it's life-threatening. 5 being it's not very significant. So 5 would be, a scratch on your finger or something like that. So the wait time is really going to be contingent upon how acute you are.
The goal is to have you wait no more than an hour or 2.
We do have 2 urgent care type areas in the emergency room, and one of those is the new area we've opened up in our lobby. And so we have extra staff to help some of those children who are sort of the 4s and 5s that have flu-like illnesses, but don't have any real significant breathing problems, maybe have a fever, maybe a little bit of vomiting, but are not very sick. So we're doing everything we can to try to work through the wait times.
Kelly joins us now live. So Kelly, when we talk about this strain, and it's incredible really to hear the numbers here of just what they're having to do because they have so many of these pediatric patients. What can parents do if their child isn't sick enough to go to the ER but is still pretty sick? Because you don't want to send them there and continue the overcrowding if they don't need to go.
Right, exactly. So the first thing you need to do is call your pediatrician for advice. But Dr. Turkovich says you're going to want to try to keep the fever down and try to keep your child hydrated. He says Tylenol or Motrin works best for the fever, but he says do not give anybody less than 6 months old Motrin. And then to keep a child hydrated, he says Pedialyte works really well. He also, Michael, wants to remind everybody to get their flu shot. A lot of people just haven't done that yet.
A lot of important information there. Kelly Dudzik telling us about, as you can see, the beds being full at our children's hospital, something we will monitor. Thank you.
Sure thing.